Hello, and welcome to For Good Health. Today we will be looking at medical treatments to stop snoring and find out what are the options. We do stress that we are not a medical channel, so we are not in any way advocating or recommending any of the following procedures or approaches to snoring. We have included this section in the video series to provide a balanced presentation of the options available. If you are in any way concerned about your snoring, especially if you are suffering loud snoring, observed episodes of stopped breathing during sleep, abrupt awakenings accompanied by gasping or choking, daytime fatigue or lapses in concentration, then you should seek medical advice at the earliest opportunity, as these can be an indicator of a more serious underlying condition. That said, let's look at a selection of the types of medical cures available for snoring. These can take the form of a surgical procedure, as well as medical devices. The first we will look at is continuous positive airway pressure. This is where a machine at your bedside blows pressurized air into a mask that you wear over your nose or face. This keeps your airway open during your nightly sleep. Laser-assisted UVulopalatoplasty. This uses a laser to shorten the uvula, which is the hanging soft tissue at the back of the throat, and to make small cuts in the soft palate either side. As the cuts heal, the surrounding tissue stiffen to prevent the vibrations that trigger snoring. Palatal implants, otherwise known as the pillar procedure. This involves inserting small plastic implants into the soft palate. This is designed to prevent the collapse of the soft palate that can cause snoring. Somnoplasty. This uses low levels of radiofrequency heat to remove tissues of the uvula and soft palate that vibrate during snoring. Custom-fitted dental devices and lower jaw positioners. These are designed to open your airway by bringing your lower jaw or your tongue forward during sleep. We have seen cheaper generic versions of these in the devices video. However, these are more expensive versions which are specially fitted by your dental practitioner. The idea being that a professionally fitted device should give the best results. Surgical procedures such as UVulopalatoplasty, thermal ablation palatoplasty, tonsillectomy, and adenoidectomy all increase the size of your airway by surgically removing tissues or correcting abnormalities. Inspire therapy. This procedure involves surgically implanting a device and components that work to sense breathing patterns and deliver mild stimulation to maintain an open airway and promote regular breathing. Septoplasty. This involves straightening your nasal septum, which can help to straighten out your nasal cavities and make it easier to breathe. There are mixed views on the long-term success of some of the surgical approaches, but if you are considering any sort of procedure or in fact have concerns over your snoring, then you should seek professional medical advice and discuss your options thoroughly with them before taking any action. I hope you have found this short video of interest. It forms part of a free series of short videos covering all aspects of snoring, sleep apnea, and remedies available. If you would like to pick up the series directly, just look in the description or the very first comment below this video for the link. Thank you for watching, and see you in the next video.